Namaskar, welcome to This Week with Padma Shri Dr. Sudhir Parikh. Doctor, welcome. Namaskar.
Namaskar.
So, as we begin again, things have not improved to the extent that we would like them to improve, referring to COVID-19 situation in India. But with increased support reaching India as well as India preparing on its own, how do you assess the situation now? The situation in India?
The situation has not been improved. Situation in a COVID situation in India has not much improved yet. Still, there is over 3 lakhs new cases every day. There is a lot of deaths every day. So, but it's getting little stable or it's stabilizing a little bit. And all the help from the international help from all over the world is pouring in. And we Indian American from here, particularly me personally, involved in sending almost 250 oxygen concentrate through our Life Global, our BJ Medical College Alumni Association, and API, and so forth. And so we are really working hard to send oxygen concentrate, some fund for vaccination, as well as the respirator. And hopefully we will see the plateau in a day or two, and then start declining the cases. And that's our hope is. But only way to control this pandemic is to give the vaccination to as many patients or as many people as one can. That's only way to end this pandemic. And unfortunately, right now, the rate of the vaccination is very slow, very poor, and as compared to the population who needs this vaccination.
Absolutely. So what you said is the general notion, and I also believe medically that vaccine would break the cycle. But today, the news from Seychelles, the nation that has most vaccinated people, is putting a question mark on this conviction because in spite of being the most vaccinated nation, Seychelles is showing again new cases, increased cases for COVID-19. So how can we account for that? What could be the reason?
Well, it could be the again variant and more mutation of the virus, but that doesn't mean that we have to give up the hope on the vaccine. Vaccine is the only way to control this virus. There is no other way. So we have government of India and state government has to do the maximum number of vaccination. But right now, the way the vaccine manufacturers are talking, looks like it will take another 2-3 months to get the number of number of dosage which we need, and that will be too late. Before that, I'm afraid that there will be a third wave, which may affect much younger children. So I think whole thing doesn't look very promising.
Absolutely true. And Doctor, if we compare in terms of the population of America and India, India is almost 4 times more, a little more than America. And in spite of having so many resources, we had to go through the cycle of losing a lot of loved ones in America. And if we look at per 1 crore the number of deaths, then we in India are still slightly behind America, but we may catch up. Now, coming to the other side about preparedness of any nation to face this kind of challenge, Supreme Court has observed rightly that in the past 70 years, our medical system is not prepared to face this kind of calamity and this kind of challenge. So, allow me to break it in two parts. One, we need a short term, immediate, strategic framework to overcome this. Two, long term strategy to be prepared for such situations. So, let us focus on the short term, Doctor. Do you think everything that can be done in the short term is in its way?
Well, I mean, hopefully, because still there is a number of beds are not enough. Still the oxygen supply is not enough. Oxygen production is there, but the distribution is not completely well organized, and still people are dying. I mean, yesterday only there was one hospital in Haryana. 8 people died because they ran out of the oxygen. So this kind of thing should not happen. Absolutely should not happen. And the number of deaths, again, we don't know the real number, because there are a lot of people are not even getting admitted in the hospital, and they're dying at home. And those counts are not counted in this number of deaths. And so they say, the expert says in India that whatever count is there, most likely it's another 8 to 10 times more than what we are looking at. So it's very dire situation. Government has to increase immediately number of the beds, open up the temporary hospitals in the stadiums, in the large facility, outdoor facilities, where one can have more beds with the oxygen. The oxygen is the most important critical treatment for this kind of most of the COVID patients. And there is a shortage of doctors and nurses there too. And therefore I think government has done right thing, that they ask medical students to be a doctor there, even though they are not completely finished their training. But I'm sure, being a medical student, they know how to treat the patients, or how to watch the patient, how to keep the observation on the patient. So that's only way to increase the number of doctors or medical healthcare professional to take care of this kind of surge of the COVID infection.
Absolutely. And Dr. There are many news which makes us feel a sense of helplessness or frustration. And just very briefly recollecting two, one from Tirupati, 11 people died because of disruption in the oxygen supply. Similar thing happened in Rajasthan, Jaipur somewhere. 20 people died because, again, due to electric supplies flow was checked, they didn't get proper oxygen, and that resulted into the death of these innocent 20 people. Now, these things can be taken care of if there is proactive and passionate response to this calamity. Now, I'll just add one line, Doctor. In order for people to be prepared, do you think there is some parallel training that can be conducted, should be conducted, that this is not the normal medical emergency, and they need to protect themselves also with PPE and all those? And we are seeing that that is not being observed properly at several places in India.
Yes, I mean, people, the population at large should be get educated. What is important, what is not important. Mask is important. Crowding is not. Crowding should not be done. How to take care of themselves when there is a family member gets infected. How to isolate them. All these thing has to be taught to the population, and make sure that population doesn't take things granted. Even after vaccination, even infection can happen. And therefore I think they have to know all this thing. And government must make sure that every hospital has at least 2 days of oxygen supply, so more than what they needed. And that way there is enough time to shunt the oxygen supply to the particular hospital.
Absolutely. And there is another situation that some of the doctors are facing. And one news came from Bangalore because of the limited supply of oxygen and beds that they have. At times, doctors find themselves in a dilemma, ethical dilemma, whether they should admit seniors first or young patients first. So, your thought, if such a situation is faced by a physician, it is very difficult to decide. Can you share your thoughts on this situation?
Yeah. This such situation should not happen. And because no human being has right to decide who can live and who can die. That's absolutely deplorable. And that also just for because lack of supply of oxygen, that's unacceptable, and therefore it should not happen. Therefore the oxygen supply has to be there, adequate supply should be there, and government should provide or make an arrangement to provide them oxygen supply a couple of days more than what they need every day. And that's only way you can have make sure that no one dies or no one get admitted because there is a lack of oxygen or lack of bed. And they have to make some create a temporary hospital to take care of those patients who needs a bed and oxygens.
Absolutely. And as you are aware, including you, many NRIs are working uh, to extend support in several ways, and many India-friendly congressmen are also concerned, and they are writing to President Biden to pump up the supplies to help India at this hour. Your thoughts on the overall mood?
Well, I think I'm very happy to learn that Biden administration has already sent so much of help, medications, some vaccine even, and the PPE to the India, and oxygen concentrates and so forth, within 1 week time. And I think that's very commendable. We should thank USA for that, and we should thank all the other countries, those who are helping India right now.
And now, as we move towards the concluding part of our conversation, at the time of any emergency or war-like situation, the nation should come forward to face it with unity. And that unity, I think, is missing, and which is also causing some additional hardship for common man. I especially speak about the kind of coordination and relationship as well as blaming happening between central government and some of the state governments.
Well, I mean, that is not very good situation that central government blames state government and state government blames central government, and that kind of bickering should stop. And they make sure that central government provides also every state equal whatever their need is, an equal distribution of the oxygen, medical supply, and healthcare providers.
And that is, of course, based on the need which is shared by respective states with the center. And though generally speaking, medical, as per India's constitution, comes under state, but then again, it is one nation, and there are shared concerns. And as we conclude, Dr. Saab, what would be your advice for our young viewers, in what way they can feel and come forward to work with other organizations which are uh, trying to see what they can do to help India?
Our young population, I mean, Indian Americans should galvanize their own group, their own organization, all other sister organization, including the non-Indian organization, American organization, Jewish organization, and so forth, and to muster as much as help they can get to help the India, and to in this kind of calamity. This is a crisis of century. Everybody should do something to help our motherland. Motherland is calling, motherland is in need, and motherland is kind of asking for our help, and we all should help motherland. And again, in conclusion, I would say, dear friends, please do get vaccination as soon as you can get opportunity to get one. Do not hesitate. Vaccination is safe, very effective, and that's only way will save your life and your loved one's life. So please do so. And thank you for joining this week with us. And we'll see you next week. God bless India. God bless America, and God bless Indian American community. Thank you. Goodbye.